Hello, this is Rashi Sahai, and you're watching Medicircle. Today, on our World Heart Awareness series, we have Dr. Sanjeev Gera with us. Dr. Sanjeev Gera is a director and HOD cardiology at Fortis Hospital, Noida, and for the past 28 years, he has been working in this field. Welcome to Medicircle, Dr. Sanjeev Gera.
Thank you.
The death toll due to heart attack in India is continuously increasing. About 2.25 lakhs Indians have died due to heart attack in 10 years. So coronary arteries disease is the most common form of heart disease and the most common cause of heart failure as well. So Indians are affected by high rates of diabetes, metabolic syndrome, hypertension, and smoking. These are the major risk factors of cardiac disease. So, doctor, can you tell us, what is heart failure and what are the different types of it?
This is very true what you just said. So basically, we are actually witnessing a lot of heart diseases and a lot of heart attacks, especially among younger population and especially after COVID era. So heart failure is a condition, or we call it as congestive heart failure also. Heart failure is a condition when heart is not able to pump enough blood as per the demands of our organs of the body. So, and heart failure can be because of variety of diseases. So, heart blockages or what we call heart attacks, heart attack, if left untreated, can lead to heart failure. Other important reason for heart failure is muscle weakness. What our body muscles become weak, the heart muscles also become weak, and they are not able to pump enough blood as per the requirements of our different organs of the body. And heart failure can be of different types. Like heart failure can be a systolic heart failure, it can be a diastolic heart failure. So systolic heart failure, there is a term called ejection fraction. When we do ultrasound of heart, which is known as echocardiography. So if we see the pumping function of heart, which is also called as ejection fraction or efficiency factor, if it is below 50%, then it is called systolic heart failure. And if it is above 50%, then it is called diastolic heart failure. So what happens in systolic heart failure? Heart is not able to pump enough blood. But in diastolic heart failure, heart function is normal, but because of variety of reasons, which we can discuss later on, the heart is not able to fill properly. So if it is not getting filled properly, it will not able to pump it effectively. So that is how actually we define heart failure.
So, doctor, what are the signs and symptoms of heart failure?
Yeah. So initial symptom, I told that heart failure is a condition when heart is not able to pump enough blood to different organs of our body. So every organ gets affected. So the important symptom is fatigue, general fatigue, and extreme fatigue. If anyone who has got heart failure and is not able to walk effectively, then we should suspect that heart function it could be low. And other important thing is shortness of breath, like he's having breathlessness on walking. What the work which he used to do in 5 minutes, now he's taking 10 minutes or 15 minutes. He's not able to climb upstairs. He's getting too much of breathlessness with sweating, fatigue, and then extreme weakness, tiredness, especially when all these things are associated with swelling over both the limbs. What happens in the initial stages, there is swelling in both lower limbs, then it can happen to whole body or especially around eyes. So these are the important symptoms and signs of heart failure.
So, doctor, there are many famous celebrities like Puneet Rajkumar, Raju Srivastav. They all suffer heart attack. So, can you tell us, heart-related cases are increasing, and how should often we go for diagnosis?
Yeah, so we are definitely seeing a lot of young heart attacks, and first of all, we should be aware of what are the causes of heart attacks in young, and what are the causes actually, what are the risk factors which actually cause heart attack. So the very important risk factor is our genetics. We as Indians actually are predisposed for early heart disease. So there are many reasons for that. Our genetics, and other thing is that our arteries are smaller as compared to Western population. So whenever there is a small cholesterol buildup or plaque buildup, then it causes early heart disease. Other important risk factors are diabetes, and we are actually witnessing a lot of pre-diabetes in our younger population, then high blood pressure, then high cholesterol. In our genetics, in our continent, actually, in our scenario, what we have got is a ratio of high bad cholesterol, there is high bad cholesterol and low good cholesterol. So this is a combination which is actually lethal and cause blockages. Other important thing is obesity. We are overweight. We have got a lot of people with abdominal obesity or abdominal actually overgrowth of fat, which is actually responsible for metabolic syndrome or insulin resistance. And this insulin resistance is actually responsible for early atherosclerosis. Early atherosclerosis is when your arteries get thickened and thickened. So at younger age, when we compare arteries of like in our scenario or as compared to Western population, we have early or premature thickening of arteries that cause high blood pressure and which ultimately leads to heart disease or heart attacks and ultimately heart failure. So we have to actually know the risk factors, what category we fall in, whether a person is low risk, whether he is moderate risk or high risk. So there is actually a scoring system which we do very routinely to assess what categories he is falling in. When we define the category, then accordingly we actually advise some tests. But important tests are like cholesterol levels, one should check every year. Another thing is HbA1c or sugar levels, then proper BP monitoring, routine BP check has to be done. Then other thing is TMT test, electrocardiogram. There is a myth about ECG. When we do ECG, only ECG can catch actually only 20% of heart disease. So ECG is just a myth. So to diagnose silent heart disease, we have to undertake a stress test, which we call treadmill test or stress echocardiography or stress tele. A variety of stress tests are there. First, we categorize the patient into low, moderate, and high risk category. Then, accordingly, we actually define the test or advise the test. Important tests are ECG, electrocardiogram, which we call. Other is echocardiogram, the ultrasound of heart to see the pumping power of the heart, to assess the muscle weakness and to assess the valve function. Then other is sometimes we do treadmill and CT angiography also, cardiac CT. Important test is treadmill test, which is a stress test, and which actually tells us whether a patient is having silent. So if anyone who has got silent heart disease or when there is treadmill test positive or stress test positive, then we advise further tests like CT angiography or coronary angiography to actually look at precisely how much is the blockage in his arteries.
So, doctor, who is at utmost risk of having a heart disease?
Like I said earlier, there are few risk factors. The very important risk factor is genetics. Okay, if anyone who has his father or mother suffering from heart disease, then definitely he's at higher risk of heart disease, especially when he has got high blood pressure, he is obese, overweight. He has to keep a check on his BMI. Any person who has got a body mass index of more than 25 or more than 27, he is overweight or obese. Then he is at a higher risk of heart disease. Then high cholesterol levels, like high bad cholesterol, low good cholesterol, sugar levels if they are high, like if the sugar levels are high. Then other thing is smoking. Smoking is a very important risk factor and which is commonly seen in younger population. Most of the younger population, they are actually busy in smoking, heavy smoking. They're heavy smokers. So what smoking leads to is thickening of blood. So if even if you don't have any other risk factor for blocking for blockages, even simple plain smoking, excessive smoking can cause clot formation in heart arteries, which can lead to massive heart attacks. So these are the individuals which are actually at high risk of heart attacks or heart block.
Okay, doctor. So, what to do as a life-saving measure after cardiac arrest, or how to prevent a heart disease?
Yeah. So first we have to understand the difference between cardiac arrest and heart attack. In heart attack, heart is still beating, but there is a heart attack. One part of heart is not functioning. But in cardiac arrest, there is complete stoppage of heart function. Heart just gets arrested. So there is a difference. Heart attack can lead to cardiac arrest, and there are many risk factors for cardiac arrest. So first we have to know that whether we are at a higher risk of heart attack or not. Then we can actually define whether a person can have cardiac arrest or not. So there are few tests which I told. So if any person, if you witness like in a gym, if person falls down and has a cardiac arrest, so there is an algorithm for that. You have to understand basic simple revival techniques, or what we call CPR, cardiopulmonary resuscitation. You must have seen or you must have known that to pump the chest with effective cardiac compression to effective chest compression, then mouth to mouth breathing. There is a typical protocol. If we give that person a typical or effective CPR within 5 to 10 minutes, then we can revive that patient. We can take that patient to the hospital, and then accordingly some tests and some different like angiography can be done and to open that blocked artery if cardiac arrest was because of blockage in the artery. But cardiac arrest can be because of many reasons like arrhythmias. When there is a fast irregular heart rhythm, that can cause cardiac arrest. Heavy exercises, even if there is blockage in the artery, then if any person who is not accustomed to heavy exercises, like he was sitting idle and he just thinks of going to hitting gym and doing heavy exercises, then he can fall on the treadmill, or he can fall while doing weights, because heart is not adapted. The artery can get ruptured. So any person who has even who has not got blockages more than 70% or 50%, that artery can get ruptured because of high blood pressure, because of intensive exercise. So we have to be very cautious. We have to first look at the risk factors, and then we have to define what exercise regime we should undertake to avoid cardiac arrest while doing intensive exercise.
Yeah. Okay, doctor. So on Medicircle, our main focus have always been to provide the audience with large amount of information in less time. And so today we will be conducting a small question session in which you could either answer in yes or no, or a 1 or 2 line answer will also do. So doctor, my first question is that does white rice increase the risk of heart failure?
No, it is not true. There is no direct link between white rice and heart failure, but definitely high white rice consumption can lead to pre-diabetes or diabetes or high cholesterol or insulin resistance, which can then ultimately cause high BP and sugar, and which can lead to heart disease or heart blockages. But not directly. There is no link between white rice.
So does excessive running lead to heart failure?
Yeah, definitely. If there is silent ischemic heart disease, or if there are silent blockages lying in the heart, if any person undertakes that excessive running, it definitely can cause heart failure and heart disease or heart attacks or cardiac arrest. So, but directly as such, excessive running in a healthy individual can't cause actually a heart failure.
So can stress cause heart failure?
No, it is not true. Stress actually can lead to different other diseases, or what we call as stress-induced syndromes. Like excessive stress can cause high BP. It can cause sugars. It can lead to a sedentary lifestyle, which can ultimately lead to overweight, obesity, diabetes. Then these other things can cause, or other diseases can cause heart failure or heart blockages. But stress is not directly related to heart failure. It can exaggerate the previous heart failure symptom, but it can't cause actually. It is not an etiology for heart failure.
Okay. Okay, doctor. Thank you so much for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure having you on the show.
Thanks, my pleasure. Thank you.